Welcome to the Bernade channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for diarrhea. Nursing diagnosis. Diarrhea. Related to inflammatory processes, adverse effects of medication, infections, dietary intolerances, or malabsorption disorders. Nursing diagnosis. Diarrhea. Part 2. Evidenced by frequent loose, watery stools, greater than 3 per day, abdominal cramping, urgency, borborygmi, perianal skin irritation, and potential signs of dehydration. Desired outcomes. One patient will demonstrate normal bowel movements, formed stools, LUV, per day, within 3 days. 2 patient will maintain adequate hydration as evidenced by stable vital signs, moist mucous membranes, and urine output greater than 30 ml/hr. Desired outcomes. Part 2. 3 patient will verbalize understanding of dietary modifications and hygiene practices to manage diarrhea within 24 hours. 4 patient will show no signs of complications, example electrolyte imbalance, skin breakdown, throughout the course of care. Assessment. 1. Assess frequency, consistency, color, and volume of stools. Note any blood or mucus. 2. Evaluate for signs of dehydration, skin turgor, mucous membrane moisture, urine output, vital signs. Assessment. Part 2. 3. Assess abdominal pain, cramping, and presence of borborygmi. 4. Monitor for fever, which may indicate infection. 5. Inspect perianal area for skin irritation or breakdown. 6. Review medication list for potential causative agents. Nursing interventions. Hydration management. 1. Encourage oral fluid intake, aiming for 2 to 3 liters per day unless contraindicated. 2. Offer oral rehydration solutions to replace electrolytes. 3. Monitor intake and output closely, reporting significant imbalances. Nursing interventions. Hydration management. Part 2. 4. Administer 4 fluids if prescribed, monitoring infusion rate and patient's response. 5. Teach patient to recognize signs of dehydration and when to seek medical attention. Nursing interventions. Dietary management. 1. Implement brat diet, bananas, rice, applesauce, toast, or as prescribed by healthcare provider. 2. Encourage small, frequent meals rather than large meals. 3. Avoid foods that may exacerbate diarrhea, example dairy, spicy foods, high-fat foods. Nursing interventions. Dietary management. Part 2. 4. Introduce probiotic-rich foods or supplements if appropriate. 5. Educate patient on gradual reintroduction of normal diet as symptoms improve. 6. Advise patient to avoid caffeine and alcohol, which can worsen diarrhea. Nursing interventions. Medication management. 1. Administer antidiarrheal medications as prescribed, explaining proper use and potential side effects. 2. Provide antispasmodics if ordered to relieve abdominal cramping. 3. Administer antibiotics if bacterial infection is confirmed, emphasizing importance of completing full course. Nursing interventions. Skincare and comfort. 1. Implement frequent perineal care using mild soap and water, patting dry gently. 2. Apply barrier cream to protect perianal skin from irritation. 3. Encourage use of soft toilet paper or wet wipes to minimize skin trauma. Nursing interventions. Infection control. 1. Implement standard precautions and contact precautions if infectious cause is suspected. 2. Educate patient and family on proper hand hygiene techniques. 3. Ensure proper disposal of contaminated materials. Nursing interventions. Patient education. 1. Teach patient about causes of diarrhea and strategies for prevention. 2. Instruct on proper food handling and preparation to prevent foodborne illness. 3. Educate on importance of medication adherence, especially for antibiotics if prescribed. Evaluation. 1. Patient's bowel movements return to normal consistency and frequency, love, per day. 2. Patient maintains adequate hydration as evidenced by stable vital signs, moist mucous membranes, and normal urine output. Evaluation. Part 2. 3. Patient demonstrates understanding of dietary modifications and hygiene practices to manage diarrhea. 4. Patient shows no signs of complications such as electrolyte imbalance or skin breakdown. 5. Patient verbalizes knowledge of when to seek medical attention for persistent or severe symptoms. Important notice. This presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burnaid app for free from the Play Store or App Store for answers to more than 3,000 questions.